Bismillahirrahmanirrahim. Welcome our student in the third session of practice of lower limb. Today we will talk about gluteal region and posterior compartment of the thigh. Firstly, the gluteal region. The definition of this region, it is the area located behind the pelvis and below to iliac crest, called buttocks. This area separate from each other by intergluteal cleft and demarcates from lower upper part of the thigh by gluteal fold. The gluteal region, firstly, it classified into superficial layer and deep layer. Superficial layer contain large muscle and deep layer contain smaller muscle. About the ligaments found in this area, also we'll talk about ligaments that convert the sciatic notch into foramen. The gluteal region contains superficial layer, this layer formed by gluteus maximus muscle. This muscle called gluteus maximus muscle originate from outer surface of ilium behind to posterior gluteal line and passes to insert in iliotibial tract some fiber in the iliotibial tract, this called iliotibial tract, to insert downward in lateral condyle of tibia, and some fiber pass downward to insert in gluteal tuberosity of femur. This called gluteus maximus muscle, supplied by inferior gluteal nerve, and its action is lateral rotation and extension of the thigh. This gluteus maximus muscle. After we reflect the gluteus maximus muscle, we find other muscle called gluteus medius muscle. This is gluteus medius muscle, which is originate from outer surface of ilium between anterior and posterior gluteal line, and fibers pass to insert in the lateral surface of greater trochanter. After we reflect the gluteus medius, here the other muscle, this one called gluteus minimus muscle. Gluteus minimus muscle arises from outer surface of ilium between anterior gluteal line and inferior gluteal line. Pass downward to insert in the anterior aspect of greater trochanter. This is greater trochanter. This is lateral part here, and this is anterior part here. The bus muscle have same nerve supply by superior gluteal nerve and have the same action. Abductor for hip joint and medial rotation to the side. This about gluteus medius muscle and gluteus minimus muscle. So, this is a remainder muscle of gluteal region. The landmark here called piriformis muscle. This piriformis muscle, okay, here, arise from anterior aspect of the sacrum, and its fiber pass downward to insert in superior aspect of greater trochanter also. This muscle supplied by anterior rami of S1 and S2 from sacral plexus itself. About action of piriformis muscle, it is abductor and lateral rotator for the thigh. Okay? Below to the abductor muscle, we have 1, 2, 3 muscle called obturator internus muscle and 2 gemelli muscle. This one in the middle called obturator internus muscle arise from anterior surface or pelvic surface of obturator membrane and pass to insert in the medial surface of greater trochanter. Okay, this muscle arises from pelvic surface of obturator membrane and insert in a medial here, in a medial side or medial surface of greater trochanter. This is greater trochanter and this is medial side of it. So this is obturator internus muscle. Above to it, the small muscle with brown here color. This muscle here, fleshy fiber, this called superior gemellus muscle. Superior gemellus muscle and inferior gemellus muscle. Superior one arises from ischial spine and the inferior one arises from ischial tuberosity of hip bone. The three muscle passes to insert in a medial surface of greater trochanter. What about action and nerve supply of these three muscles? The obturator internus supply by nerve called nerve to obturator internus come from sacral plexus. This nerve also supply the superior gemellus muscle, okay, and the inferior gemellus muscle supplied by nerve to quadratus muscle. This nerve for the other muscle here called quadratus femoris here. Okay. What about action of the three muscle obturator internus and three gemelli? It is lateral, rotator, and abductor of thigh. And finally, this is last one in the gluteal region. This muscle called quadratus femoris muscle. This muscle arises from ischial tuberosity and pass to insert in quadrate tubercle of femur, in the quadrate tubercle of femur. The nerve supply of this muscle called nerve to quadratus femoris, which come from sacral plexus, same nerve for supply of inferior gemellus muscle. What about action? Lateral rotator of thigh and steady of head of femur in acetabulum. In the gluteal region also we can find the vessels and nerve. How can I differentiate or how I can demonstrate the vessels and nerve in this area? Firstly, this piriformis muscle is landmark. This piriformis muscle, landmark in the gluteal region. The structure or the vessels and nerve. Above to it here, this superior gluteal vessels and nerve. This is nerve, okay, and this is superior gluteal vessels, artery and vein, which is distributed to supply the gluteus medius muscle and minimus muscle. Below to the piriformis muscle, we can see here very clear structure. This called sciatic nerve. Sciatic nerve. Above to it, this called posterior cutaneous nerve of thigh. Okay, and here this is a commencement of inferior gluteal vessels. Okay, more medial structure, as we know here, sacrotuberous ligament and sacrospinous ligament convert the greater sciatic notch and lesser sciatic notch into foramina. This foramina, this is greater sciatic foramen and this is lesser sciatic foramen. They structure here, this one called pudendal nerve and this called internal pudendal vessels, artery and vein, arise or pass from greater sciatic foramen to enter in the lateral sciatic foramen, here to pass into perineum. Okay? This is about structure that you can see in this specimen. Close related to the obturator internus and quadratus femoris, there is a small muscular nerve called nerve to obturatus and nerve to quadratus femoris. You cannot see here in this specimen. Okay? Posterior compartment of the thigh consists of 3 muscles called hamstring muscle. Okay? Semitendinosus and semimembranosus and biceps femoris muscle. This medial side of the thigh and this is lateral side of thigh. Firstly, this muscle from medial or more medial one, this semitendinosus muscle, arise from ischial tuberosity and pass downward to insert in the posterior medial part of tibia, supplied by tibial nerve of sciatic, and it is action extend hip joint and flex and medial rotation for the leg. The second one here, this is a semitendinosus, semimembranosus muscle. Okay, you can see here the origin of muscle look like what? Membrane. So it's called semimembranous muscle. Arise from ischial tuberosity, also pass downward to insert in the posterior part or surface of medial condyle of tibia. It has same nerve supply and same action of semitendinosus. Okay? Extend hip joint, flex and medial rotation for the leg. The third one muscle called biceps femoris muscle. Biceps, that means it has 2 heads. This head and this is another one. This is a long head of biceps muscle and this is a short head of biceps muscle. The long head arises from ischial tuberosity also, and the short head arises from linea aspera of the femur. Both heads unite and insert in the lateral surface of fibula, head of fibula, in the lateral surface of head of fibula. Action of this muscle is flexion of the leg and lateral rotation of leg. Okay? The both head, flex and lateral rotation for leg. About nerve supply, the long head supplied by tibial branch of sciatic like semitendinosus and semimembranosus. The only exception here, the short head supplied by common peroneal nerve of sciatic nerve.